Hi, everyone. Welcome to CEH's very first Audacious Action virtual town hall. If you didn't already know, the Center for Environmental Health protects you and your family from toxic chemicals using science, policy, litigation, collaboration with the most sustainable companies in the country. And we do this in ways that create measurable change to protect all of our health. You'll see a text to donate link along the bottom during the whole program. I will not mind if you actually click on that link. You can also go to the CEH website. That would be ceh.org/donate. If you're going to be tweeting during this, feel free to use the hashtag CEH Town Hall as a way to link to all of us who are on it, the hundreds and hundreds of people who are on this call. I also want to, before we get started, I want to thank our really generous supporters. That's the Footprint Corporation, Lexington Law Group, Blue Cross Blue Shield of Massachusetts, LinkedIn, the Ponterea Fund, and a lot more. They'll be in the chat box, so you'll see who they are. So now let's get to the main event. I'm excited to introduce these three speakers. They're all people who I admire greatly and have known for a long time. They're working to reduce our exposure to toxic chemicals in our homes, in our food, in our water, in our environment. And what we and they are going to talk about today is how we all can stay healthy during a pandemic. So the first one I want to introduce is the newest member of the CEH Board of Directors, Dr. Vin Gupta. So you may recognize him. He's been on CNN and MSNBC or seen his stuff in the New York Times. He's a public health physician, professor, health policy expert. Vin, I'll pass the mic to you.
Michael, thank you so much for convening us. It's so great to be here with everybody to talk about this really important issue. I'm going to just spend the next few minutes giving my lens on where we are with the pandemic and how environmental health considerations are really vital as we think about how do we keep ourselves and our families healthy. Because this component here, environmental health, has been, in my opinion, neglected. I say this as a lung doc, dealing with keeping our lungs healthy, keeping my patients healthy from a variety of insults, including COVID-19, but also the air we breathe. This interaction between the environment and the pandemic has been neglected in the last 6 months, and we really need to talk about it. So what do I mean? We're entering a really dangerous phase now. And I know for those listeners online, they're probably exhausted in hearing that. You want to hear some good news. You don't want to hear more doom and gloom. So I do have some good news to share. I'll save it if we have time. But here I want to focus on some of the urgent issues of the day. We're seeing now, especially with many parts of California enveloped in wildfire smoke, with economies opening up again, with school districts opening up again, greenhouse gases getting emitted into the air. We're seeing emerging evidence that exposure to high levels of air pollution, whether it's from a wildfire next to you, or whether it's from a smokestack or from just cars revving up again, that actually is increasing the likelihood of infection from COVID-19. So we know COVID-19 is permeating in many cases. There's community transmission in many parts of the country, but exposure doesn't necessarily mean you're going to get infected. But what we're seeing now, just last week, some compelling evidence was published suggesting that exposure to COVID-19 in the setting of air pollution actually can increase likelihood of a successful infection, which is concerning. That's really concerning as our kids go back to school, as our economies open up again, despite perhaps the best evidence that here we are with this interaction between a once in a century pandemic and these environmental pollutants that we've been battling and hoping to get our hands around for decades now. Now they're interacting, and that's concerning. There's issues on testing that we really need to get a handle on, which I can go into in a bit if we have time. But lots of important topics to delve in, and I'll leave it at there. I'll leave it at that for right now. But again, thank you for having me.
That's great. So next is Kelly. Kelly Vlahakis-Hanks is the president and the CEO of ECOS. And I just want to say that I have witnessed both Kelly and ECOS playing a really strong leadership role from the private sector in trying to protect all of our health from toxic chemicals. Kelly?
Thank you so much, Michael. I really appreciate you having me here today. It's such a pleasure to be here with Professor Hayes and Dr. Gupta to really talk about the importance of protecting our environment and our health, especially as we face this pandemic. A little bit about our company. We've been around for 53 years. And for 53 years, we've been dedicated to making products that protect people, pets, and the planet. And I think, I will just never forget March 16th as the orders rolled in and I realized the great importance. I mean, cleaning products are the number one weapon in the war on COVID, and we must make sure to clean to protect ourselves. But at the same time, we don't want the pendulum to swing too far in the other way and have cleaning products actually harm our health. I love the fact that, Dr. Gupta, like you said, he's a lung doctor, understands that so many of these chemicals are so dangerous for human health, the health of our lungs. And obviously, with lungs being a primary focal point with the COVID virus, we want to make sure to protect our lungs and to protect ourselves. The reality is, in the United States, there's no requirement to disclose ingredients in cleaning products. And that is really shocking because I think consumers understand now it's not just what you eat or what you put on your body, it's also what's around you. And the cleaning products that you use have an effect on your health. And we now know that the cumulative effect of exposure to a lot of the ingredients that are in cleaning products over time are linked to cancer, asthma, nerve and organ damage, and so many other illnesses. And so I always talk to people, think about the residue that's on your clothes. Your skin's the largest organ in your body. If you're washing your clothes in something that leaves a toxic residue, it's being absorbed quickly through your skin. If you're washing your plates or glasses and then drinking out of them or eating off of them and there's toxic residue, it also is being absorbed. And it's just amazing because so often you can look at the back of a cleaning product, you see skulls and crossbones and it says do not ingest. Yet every single day we're ingesting these things when we put our water in that glass. And so I think it's really important that consumers here in the United States realize they need to protect themselves by reading the ingredients, by checking the labels. And this is more important now in this COVID crisis than perhaps ever before, because there's nothing more important than preventing the underlying conditions that make you more vulnerable or increasing your immune system capabilities to prevent getting the virus. And so I really want people to look at those things. In 2017, Governor Brown here in California actually passed the Cleaning Products Right to Know Act. And that was the first act in the nation that required the listing of ingredients on cleaning products. That went into effect here in this state so that people can now go online to see the ingredients. But I hope this nation in the near future passes that nationally because we all have a right to know. We should demand transparency and we should be looking at these very dangerous chemicals that are in cleaning products. What we've sought to do here is to make over 200 products. We utilize the US EPA's Safer Choice Program as a third-party certifying agency to check that, number one, we're using the greenest ingredients. Number two, our products are efficacious because certainly we want products that work well, that's truly sustainable and effective against the virus. And three, we're always innovating in terms of green science. So really happy to be here on the program today and to talk about the important role that cleaning products play in our health today as we battle COVID and in the health of our families, our loved ones, and on our planet as we move forward.
Thank you. And last but not least, Tyrone Hayes is a professor of integrative biology at the University of California, Berkeley. He's one of the world's experts on hormone mimicking chemicals that are being manufactured by humans. And looking forward to hearing from you, Tyrone.
Thank you, Michael. It's also my pleasure to be here, my pleasure and my honor. I like to describe myself as a little boy who likes frogs. That's how I got into science. And I've been interested in the role of hormones in coordinating frog development and coordinating that development with the environment for as long as I can remember. And about 20 years ago, I became involved in examining what are called endocrine disruptors. These are chemicals that interfere with hormones and that disrupts an individual's ability to develop and grow properly. I'm probably best known for my work on atrazine. It's an agricultural chemical, an herbicide that causes inappropriate estrogen expression, and results being it can cause genetically male frogs to develop ovaries. It can inhibit reproduction of adult male frogs. But we also showed in my work that if you mix agrochemicals together, the way that they're really applied to fields, to agricultural fields, that you can also lower the immune system, and you can make frogs more vulnerable to diseases and parasites. In some of our experiments, we even showed that frogs can't survive a simple yeast infection when they're exposed to multiple chemicals together, and had their stress hormone levels increased and impacting their immune system. But furthermore, there are data and associations between similar effects in humans and chemical exposure. So atrazine, for example, is associated with birth defects. It's associated with reproductive cancers. It's associated with low sperm count in humans, and mixtures of pesticides, a number of pesticides, are also associated with poor immune function and increased disease rates. So this little boy who likes frogs has become very much involved in and was introduced to terms like environmental justice, because of course the people who are more likely to work in and live in places where they're exposed to these chemicals are immigrants, low income, and people of color, and that's become a big concern of mine. One of the things that, I guess, one of the good things that's happened since COVID is that, at least when I follow social media, so many people are making their own sourdough bread and growing their own vegetables, and so they're now exposed to presumably less pesticides now that they're growing at home. But what I'd like to remind people is that while many of us are keeping safe, the people who grow our food in California are here in 110 degree weather, being exposed to pesticides on large industrial farms, and now breathing in the smoke. So this combination of assaults on their bodies will undoubtedly have greater impact on their health and outcome.
Thanks. Well, I'm going to make sure that we get to talk about that more during the hour. So for everybody, the connection between the endocrine disrupting chemicals that Tyrone just mentioned, EDCs in our vocabulary, and the rise of chronic diseases and increased vulnerability to COVID-19, all those connections are becoming clearer each day. But the pressure to disinfect buildings may have people increase their use of toxic cleaning products, or to buy furniture or treat furniture with antimicrobials that have hormone mimicking chemical properties. And so that is not only putting people's health at risk more in the short term, but also with the long term potentially. So Tyrone, your academic research, obviously being focused on this, can you tell us what is the hormone system? What does it do? And why is it so important that we don't unintentionally hijack it with toxic chemicals?
You know, it's funny. I'm about to. Thank you for the question, Michael. I'm about to start my online teaching, which I'm really nervous about. I teach a course in human endocrinology, and I often, as the last question on the final exam, after they've had an entire semester, I'll give everybody 10 extra points if you can name something that is not affected by hormones. And the short answer to your question is almost every aspect of our lives involve hormones. We could not make sperm and egg without hormones. We could not get pregnant and maintain a pregnancy without hormones. We could not make milk and produce milk without hormones. Our maternal behaviors are controlled by hormones. Our growth is controlled by hormones. Our skin and the darkness of our skin and tanning involves hormones. Our ability to maintain calcium in our bones involves hormones. Our metabolism involves hormones. And when those hormones are disrupted by chemicals, that means every one of those processes that I've named will not function properly. But in addition, hormones also control a lot of diseases and conditions like cancer. Many cancers are hormone dependent, and many tumors produce hormones that also cause us to not develop properly and not grow properly. Our immune system is controlled and impacted by hormones. So virtually every aspect of our development and growth and physiological function involves hormones. I've never seen a good answer on my exam. I've never seen anybody name something that somehow is not dependent on hormones.
So I wonder if one of the 300 or 400 people on the call right now are in your endocrinology class right now, and now they're getting a step up. Vin, how are you seeing underlying conditions and COVID interacting?
No, Michael, a critical question. And so in the last 6 months, we know things now and that we didn't know in March. One of which is intuitive, which is that any underlying lung or cardiovascular disease, whether perhaps caused by long-term exposure to what Tyrone was mentioning, endocrine disrupting chemicals that we know can get volatilized. We know that in many cases, these organic compounds, actually you breathe in some of these organic compounds, and they can impact and cause early mortality, can cause lung disease on their own. We know that separately speaking, any pre-existing disease, but particularly those of the lungs or the cardiovascular system, connotes a worsened outcome from COVID-19. I really liked what Tyrone mentioned, because all of these risk factors have a social justice lens to them. We know where individuals, generally speaking, are inhaling poor air. We know it's in urban areas, urban underserved areas where there's poor ventilation, rural areas where you largely have a migrant community that's trying to subsist off really hard work in farm fields. That's what we know. We know that these risk factors are predominantly borne by individuals that can't escape to the Hamptons, that can't go and do telework predominantly day in and day out in well-ventilated areas. So that's the key piece here, Michael, that we didn't know 6 months ago, but we thought we knew 6 months ago, which we definitely know now, which is that regardless of your age, if you're 20 or if you're 80, if you have this chronic exposure, if you have a chronic disease, you will do poorly from COVID-19. And this matters because it's not just about the current pandemic, but what's COVID-22 look like? God forbid there's COVID-22. We are worried about the next pandemic, because in the last 10 years, there's been 4 epidemics of pandemic potential. One really bore itself out as a true pandemic, COVID-19. There's H1N1, there was Ebola, there was Zika. This is not going away. So we need to we have to be forward thinking when it comes to improving environmental health, because that's going to better allow individuals across different socioeconomic stratas to contend with the next pandemic, which is assuredly going to be a respiratory pathogen, either a flu virus or another coronavirus.
Okay, so that's daunting. And so Kelly, when people are thinking about what they can do to protect the sanctity of their homes and the sanctuary that is their home from the coronavirus, but hearing what Tyrone and Vin just talked about with risks of lowering immunity by using strong toxic chemicals to protect them from the coronavirus, worsening underlying conditions, creating potential long-term health. What ingredients should people be looking for in the products that they bring into their homes, especially cleaning products, but also anything else that you have on your mind?
Absolutely. Well, I think first and foremost, they should be looking at plant-powered ingredients, a real return to nature to do the power. You know, when you read what the CDC says, the Center for Disease Control clearly says in their guidelines that number 1, you clean, and number 2, you disinfect. It doesn't say to take a disinfectant and do all of your cleaning with it. So I really hope that people go to the CDC's website and read what they say. Step 1 is to clean. And when people are cleaning, they should always look for safer green products. They should look for things like coconut oil and natural fragrances. When we're doing disinfectants here, we're using citric acid and hydrogen peroxide and things that don't have the long-term damaging effects on human health. And so I think that, people became extremely afraid, as I understand they would be, but they're really doing a lot more harm by cleaning so frequently with these disinfectants. I talked a little bit earlier about reading those ingredients. I talked about the US EPA's Safer Choice program and looking for those third-party certifications. That's what they should be doing. The ingredients that they should be looking at in their cleaning products should be ingredients that really, build our health and not subtract from it.
Great.
Michael, can I just emphasize a quick point here just on that? Because I really loved all those statements. One thing also we know now that we didn't know a few months ago is a better understanding of how COVID-19 transmits in the environment. And so we need to have a clear-eyed sense of how do you get this virus? And it's tough for folks like myself because I have to get reminded what, for example, airborne transmission versus droplet transmission is, with big signs telling me what the difference is in the hospital, because they don't trust us docs to remember the difference. And yet we use these terminologies as though everybody's an expert in the public sphere. It's really confusing. But the take-home point here is, and I don't have to go into the droplet airborne debate unless you want me to, the key piece here is that it gets transmitted largely, this virus, through the air. And we think airborne specifically, which is particularly daunting to control in the setting of intermittent mask use, you name it, high quality masking, the lack of it, et cetera. But surface transmission of COVID-19, there's not as much evidence that COVID-19 subsists for long periods of time on plastic and on cardboard. If anything, the more we're learning on fabric, the more we're learning is that it doesn't have that much of a lifespan on fabric, on cardboard, on plastic. So the point is, and what virus is cultured is not necessarily virus that's going to inoculate you and cause infection. So the emerging evidence here suggests, even though COVID-19 could subsist on that wood desk in front of you or on your Amazon package or whatever it may be, it's probably not enough to actually inoculate and cause real infection in a human being. And then it generally goes away pretty quickly. So over-indexing on harsh chemicals all throughout a workplace all the time might be more for optics than for human health.
Totally get that. So since this pandemic started, here at the Center for Environmental Health, we've been getting a zillion calls from schools and businesses on how to safely disinfect their spaces. Lots of times it's partners that we've been working with for years, and we've been talking about other things up until now. And so one thing is, I'm going to drop a fact sheet into the chat of a fact sheet that we created for schools. We also created a webinar on the efficacy of antimicrobials that was hugely popular, and there were a lot of procurement folks from the private sector and from academia and other places that came to that. So I'll also drop that recording from that webinar into the chat. I don't know about you guys, but I'm getting so many ads on my screen about gloves and masks and everything else. And to me, it's a little scary to listen to the three of you and to be thinking about the limited research, the limited data that we have on the health effects of these chemicals, while the explosion of our use of them is going on. And so right now we're seeing schools reopen. We're seeing states that some of them are closing down more, some of them are opening up more. So my last question for all three of you is, what's one action that people can do to protect themselves both from COVID and from chemicals like hormone mimicking chemicals and other toxic chemicals in our lives?
I can go first. I love what Dr. Gupta just said about not over-indexing on the use of disinfectants, especially around our children and in classrooms and places where, I'd seen a study that said that prison mates actually have more outdoor time than oftentimes our children do because they're always inside. And so it's really important, the environment that they're in all day. So as people move back into the schools and into the workplaces and other areas, it's very important to think about the indoor air quality. A lot of times people think about outside air pollution, but the EPA estimates that indoor air pollution can be 5 to 70 times greater than outdoor air pollution. And that's primarily because of toxic cleaning products. So as we now know, there's a definitive link between being more susceptible to this virus and having poor outcomes to this virus if you're exposed to polluted environments, we want to make sure that as we bring our children back in the classrooms, we don't create a toxic environment in which they're spending their entire days, because that will only lead to more cases of asthma, more lung issues, and more health issues that will weaken our children.
Got you. Finn or Tyrone?
Yes, I would say also, well, here in California, of course, we have special problems now with being outside with the, I mean, I can't actually see anything outside of my window. It's completely white smog. So that's a difficult one. So it is important to get outside and get exercise and things like that. But now here with the risk of high heat and the risk of smoke, it's difficult. So I think as well, paying attention to inside surfaces, I think eating local and organic is important. And I think for those, it seems like so many people now who are growing at home, to avoid using over-the-counter chemicals that you would use in the garden and to try to grow organically. I don't know if it works for everybody else, but occasionally I have weeds in my garden, and without using weed killers, those weeds persist. And many times the aphids, the pests, like the weeds more than they like my plants. So if you leave the weeds alone, you won't and not use the herbicides, you won't need the pesticides, the insecticides as well. So that would be another one of my recommendations.
Michael, I'm happy to close out here. This is a tough question. As Tyrone just mentioned, my initial instinct was to say, well, for the rest of the country that's not battling these horrible wildfires, which California is bearing the brunt of right now. If you're a family struggling with the decision to whether or not you want to send your children back to school, or if you have vulnerable elderly grandparents, for example, in the home, it's a really challenging question. I don't think anybody has given us a good answer about what to do. And maybe it's 50 different approaches because every state has its own unique challenges. I hate that. I wish there was a national standard. I wish there was, of course, clear messaging and a unified sort of approach here. What do I think? More than anything, to keep yourself healthy, in addition to just common sense, hand sanitizing, whether it's soap and water for 20 seconds or alcohol-based, with hydrogen peroxide perhaps as an active ingredient, sanitizing sprays or gels. It's high quality masking. Recently myself and some of my colleagues in public health had issued a letter to the senior health officials suggesting that the time for innovating, we're innovating in the rapid point of care testing space, appropriately so, but we haven't actually innovated in the masking space. And for a respiratory pathogen, that's really vital. It's not just putting a mask is important, but again, a surgical mask or a cloth mask is only going to do so much. It's better than nothing, and it's vital that we all do it. But what we want is a high quality mask that is similar to an N95 mask and well fitting. But we don't have that discussion, Michael, because how much we're still debating whether or not you need to wear a mask in the first place. And so that's the challenge here, especially in a place like California, where you can't just go out and have an outdoor class because there's wildfire smoke. If you're going to go out and venture out, if your children are going to go out and venture out, or if they're still in person school in some districts, everybody has to wear a mask. If you have a young child that is not capable of wearing a mask, because young children, I have a 3-year-old, is, after an hour, it's tough.
Yeah.
That's where I would say there's certain, it's an age-based approach about who goes back to school, who doesn't. It's very family specific, but we need to give guidelines as public health officials about what is and is not reasonable. And unfortunately, we just haven't given people the tools they need to contend with an airborne transmitted disease as we send them back into an enclosed, poorly ventilated environment like a school. It's actually kind of absurd when you think about what we're about to do, but we're about to do it in the absence of testing and the right type of mask. So I feel for all the families in the country on this issue. I don't think there's a great solution, but happy to talk more about masking.
So of course that makes me wonder, what do we want from the government more? And I don't necessarily mean the federal government. It could also be local or state. But what is like a piece of low-hanging fruit that you can imagine government doing? Whether, Kelly, it's from your perspective dealing with regulators or any of the three of you. Do you guys have thoughts on that?
I certainly would love to see a national mandate for mask wearing. I mean, I think that the lack of national leadership on this issue is so horrific because the consequences are so grave. I can tell you firsthand, I mean, we've been open every day here at ECOS, right? I never had the ability to close our doors because the need for cleaning products was so great. And I said to all my teams here, it's true patriotism, which is what I think they exhibited by rising up when their country needed them the most. But my number one concern in staying open throughout this entire pandemic was how to keep my team safe. And, as we moved through this from March to April, it is 100% clear to me that wearing masks is what does it. If you have team members on production lines 6 feet apart wearing masks, there is zero transmission happening. And so when we know this information, the fact that there's no national mandate to implement this, to protect our workers, to protect everybody in our country is truly sad. And I think now, I mean, I see it in my business, how effective and how well it works. And I know there's many other businesses across the country that can testify the same way. And so I agree to have schools going back in, to have, I mean, you mentioned the fact that if a child is old enough to wear a mask, they must. Yet I see here in California them talking about children who are, third grade and under not having to wear them. It's just unbelievable to me. So I certainly would like to see that as well. Obviously, on the chemical front, I would love to see the Cleaning Products Right to Know Act on a national level.
Mhm.
I would like to see our consumers have access to information. Everyone has to make decisions, but they truly have the right to know what they're bringing into their homes. There was a lot of pushback in the food industry when this legislation went through. Many food manufacturers said, oh, it's proprietary, we can't share. But the honest truth is that every cleaning products company in this nation can reverse engineer my product and know what's in it. So none of my competitors don't know what's in my product. I know what's in their products. The only people that don't know what's in our cleaning products are the consumers that are walking into the store. And that's just terrible. So I think we just need to be really honest, and we need to be able to say that, even natural ingredients, someone might have an allergy. They have the right to know if there's natural lavender and they'll have an allergic reaction. But when we know, actually my VP of innovation, Jenna Arkin, actually had Professor Hayes as a professor about 15 years ago. And she is just such a dynamic member of my executive team. And she actually oversees all of the research and development that we do here at ECOS. And so, she put together this really robust list of ingredients that we call the nasties. And these are things in cleaning products that are endocrine disruptors, sensitizers, carcinogens, developmental and reproductive toxins, eye and skin corrosives, mutagens, neurotoxins, all sorts of things that are in our cleaning products. And so we have that own list that we go by and we say, hey, we'll never have these 500 chemicals in any of our products because we know the harm that they have. But I certainly would love to see a national Cleaning Products Right to Know Act. And if we're not going to regulate, at least put the information in the hands of the decision makers.
That's super practical. Tyrone or Vin, anything about the government? I have 100 other questions, so you don't have to feel out.
Well, I was going to agree. I think the right to know is important. I've gotten into this issue regarding GMOs, and which we tried to have done in California, and it's not just even just if something is dangerous, but in the case of GMOs, I think you have a right to know and a right to make a decision that I'm not going to purchase this thing. Even if they want to, there's an argument about whether or not it's a health risk, it should be your choice. And I'm going to disagree a little bit with Kelly in that I think sometimes the right to know is I think what you said was if you're not going to regulate, at least at least have the right to know. But one of the things I'm happy about Prop 65 in California, where atrazine, for example, is labeled as a reproductive toxin. But a lot of times that labeling, like when you walk into a gas station or you walk into a grocery store and you see the label warning chemicals used in this area, no, you're still being exposed. So now So I wish there were harder. I mean, I wish there were more stringent laws. And when the EPA finally said, for example, that atrazine is a reproductive toxin, then get rid of it. When glyphosate has finally been associated with non-Hodgkin's lymphoma and you lost a big lawsuit, then get rid of it. Why are you keeping it around? So that other grounds workers and other people will get exposed and be harmed by chemical that is harmful. So I wish there were stronger regulations and across the United States federally, not just state by state by state. I wish no matter where you live, you could get protection.
Oh, and Professor Hayes, I'd like to just jump in here that I 100% agree with stronger regulation. So in no way did I mean that it was enough to just know.
Oh, I know. I'm sorry.
Okay.
I didn't say that way.
So knowing is step one, but
Yeah.
we've been fighting very hard here for there to be better regulations. So the Toxic Substances Control Act, I fought very hard, traveled back and forth to DC, and I was so sad when they passed that legislation. And if you can imagine, when the EPA was created in 1970, they grandfathered in 83,000 chemicals that they never checked for human health and safety. And so we're fighting here to say, hey, listen, we need to start checking these chemicals. When they passed that legislation and they came out and said that the government would check 10 chemicals a year, I just couldn't even believe it. 10 chemicals, you grandfathered in 83,000. And when they came out with that list of 10 chemicals they would check a year, the first one was asbestos. Who doesn't know that asbestos should be banned? Like, it's ridiculous. So I couldn't agree more that, that we have to go one step farther and certainly get these very dangerous chemicals out of circulation. It's so sad. I mean, a child is born with 200 chemicals coursing through their body at birth. We've already set them up for so many issues during their lifetime, and it's really unfair.
Vin, you want to talk about the government, or should I go to something else?
I'll give you 3 quick bullets. The first, and probably not surprising, is I'll focus on what's in our ambient environment, what we breathe in. Progressive weakening of the Clean Air Act, especially under this current administration, that needs to be reversed. Hopefully, on day one of a new administration. Automobile standards in places like California, we've had federal assaults on just recently, and that, of course, is not helpful. A forward-thinking approach with federal assistance to help mitigate the risk of a wildfire. I mean, we shouldn't leave this on the states. We need federal support across a range of different initiatives to mitigate the risk of the next wildfire, because California, unfortunately, means so much to this country, but we also need to help your state minimize the risk of the next outbreak during the next wildfire season. So that's going to be key too, to improving overall ambient air quality. What I would also say is, in addition to we need a national initiative of moonshot on, again, high quality masking. I can't tell you this enough. The N95 mask that you hear all about in the last 6 months, especially, I was wearing the wrong size mask because I didn't have the proper fit test for a few years prior to just a few months ago. So this notion that it's easy to say, it's a good soundbite, but high quality masking, I know it's a distal solution to the proximal problems here, which are pandemic and environmental triggers, that interaction, but we need a national moonshot on masking. And then finally, for those families in California who are struggling with wildfire smoke and a pandemic, should family members even be venturing out to the grocery store if they're really vulnerable? What do you need? You need something like, I won't show the company's name, it's a Californian company, but you need a rapid point of care test. I love to show how simple and accessible these instruments are. We need these in the households of all individuals, especially in places like California, that can give family members and families, especially vulnerable individuals and families, information they need. So if it's terrible smoke outside and they're positive because they have a readily accessible test for COVID-19 or flu or COVID-22, whatever it may be, they have that information, they're armed with it so they can protect themselves, they don't have to go to an ER. We need to make, with primary care becoming much more virtual and much more home-based, we need to get diagnostics in the home so we can give people that information they need to stay healthy.
I hear you. I want to, I'm like torn between, I'm enjoying this so much, and I also want to make sure, because there's a couple other topics I want to make sure we hit. One of them is something that Tyrone, you brought up in the intros. And so if you think about, and that's justice. And so if you look at environmental justice concerns and how the racial and ethnic minorities have been more exposed to EDCs in their day-to-day lives through their air, their water, their food, and the products that are sold to them and marketed to them, and then the health disparities from COVID. Can you share with us your thoughts on the association between those two things and what we should be doing about it?
I'm certainly less of an expert on COVID and respiratory, but certainly with regards to endocrine disrupting chemicals, there's very clear data that, as I said earlier, if you're low income, first generation, if you're a minority, you're more likely to get and die from. And certainly when you think of things like cancers, my colleagues who study cancer say less than 30% of cancer is explained by genetics. So the heritability of cancer is associated by, so I usually say when I give my lecture, doesn't mean that you have bad genes. It means that you've been exposed to the same crap as the rest of your family. And again, if you're low income, first generation, or person of color, you're more likely. There's an even bigger concern in that even if you move away, you oftentimes are carrying these chemicals in your body. Like every American has DDT in their body, a chemical that we haven't used since the 1970s. We're all carrying it. But what's more is these chemicals can get passed down to the fetus. As you already mentioned, the number I've heard is up to 300 chemicals. There can be up to exposure to over 300 synthetic chemicals in the womb. Doesn't matter if it's 200 or 300, really, right? It's more than it should be. Most of them, we have no idea what they do. We now know that many of these chemicals can come across in breast milk. And I'm always torn because, somebody will always say, so we shouldn't breastfeed. And like, no, that's not what I said. But, when you're passing toxins into the breast milk, how do you make those decisions? And the other thing that's even more disturbing is the increased data now showing transgenerational effects, showing that you can get changes, not mutations, but changes in how genes are expressed, can show up 2, 3, in my frogs, I can tell you as many as 5 generations after the exposure. So even if let's say you're low income or you're a minority and you're able to move out of that environment, you're able to change jobs and get jobs that don't carry that exposure, that legacy, that exposure may be your legacy for another 3, 4, 5 generations. Atrazine is an example. In rodents, it's been shown that rats can be affected 3 generations or more after the exposure of the original exposure.
Okay, my next question, Kelly, I'm going through questions that we got from people who are on the call now. The pandemic offers an opportunity to engage the public around the issue of safe cleaning as well as reducing waste. But we're in a moment where we're creating an enormous amount of waste in an effort to reduce exposure to COVID-19. So how is ECOS and how should companies that are manufacturers be addressing these two different things at the same time?
Oh, great question. So I think that, who you are as a person, how you live your life, these things shouldn't change because of the pandemic. The mission that we operate on, all of our manufacturing facilities are zero waste manufacturing facilities. So I have manufacturing facilities here in California, in Illinois, in New Jersey, in Washington, and I also have manufacturing facilities in Greece. All of our facilities are zero waste. And that's a difficult thing to achieve when you're servicing retail partners like Walmart and Costco and Sam's and, large national and global retail partners. But we've been able to do that because we've looked at each and every one of our inputs. So even as we, added second shifts and we increased production and we did all sorts of things, we still stayed true to our mission of being zero waste. And we're audited every year to make sure that we divert more than 95% of our waste from the landfills. And I think that businesses should really take a look at doing that as well. It's not just the right thing to do for our planet, it's the right thing to do for your bottom line. You actually reduce costs when you're able to reuse things and repair things and rethink the way in which you engage in business. We've been innovating a lot in terms of the plastic reduction space. I'm really happy that consumers are finally understanding the need to reduce these things. So thinking of things, I'll just show you, like one of the things we have here is our laundry detergent. This is our new laundry detergent this year. And so what we did was we removed the plastic entirely. And so now, instead of a large plastic bottle, you have a simple sheet, and you just throw that in your wash, or you take it in wherever you're going and you use this to wash your clothes, right? So things like this companies can be doing to think of ways in which we can reduce the amount of plastics. You know, we're very focused on COVID right now, and we must be. I understand that immediate threat, but the huge existential threat that climate change poses is still there. And so once again, we can't allow our focus to entirely shift and now think, just throw it out, just waste it, just get rid of it. We need to still be very focused on the actions that we make every day. We don't want this time period to cause a setback that's irreversible. And I think we all know that the clock is ticking, and that clock still remains extremely loud during this crisis.
Yeah. Here's the question that I was most curious about when it came across my screen. And so I'll put it to you, although others might have an opinion. It's about hand sanitizers and kids who put their hands in their mouth. So I run an environmental organization, focused on environmental health, and I'm really looking forward to getting the right answer so that I can actually say the right thing in response to this question. So when you think of hand sanitizer, when you think of young kids, my kids are now old enough, they don't put their hands in their mouth in that way, but are there precautions we can take? Should we be worried about it? Is that safe? What are your thoughts on that?
No, absolutely. And I should caution by saying, first of all, I'm an adult doc, but I'm married to a pediatrician, so we've had these conversations, and so some of this is informed. And I have a 3-year-old that does all the aforementioned behaviors, so some anecdotal experience as well. This is what we know, Michael. We know that the hand sanitizers that are out there, whether they're in spray form or say Purell, those that are at least 60% alcohol-based, will be effective. That's CDC guidelines. We want them at least 60% alcohol based, whether you have additions like glycerin to make your hands soft, hydrogen peroxide, those are additional ingredients that we think are safe and effective as part of any hand sanitizer. And I can certainly give a list of recommended sanitizers and as part of a follow-up email. What I would say here is it's all about precautions. So it's all about, if you're a parent to a young child that predisposes to some of these behaviors, what child doesn't to some degree, bring travel size bottles out of reach of children. What we do know is that the National Poison Center has observed a 46% increase in child-related intoxication or poisoning events as a result of consuming hand sanitizers, because alcohol intoxication isn't hard for children. Given the proof of some of these hand sanitizers, how much alcohol they actually have, it's quite easy to actually cause some degree of alcohol poisoning in children. So you have to keep them out of reach of children. Travel-sized sprays are personally what we employ in our family. It's harder to actually manipulate the top. So that's been effective, but small volumes, really key. Put them in your purses, put them in your backpacks, out of reach of children. Secondarily, and this is where I just want to make sure I'm getting the actual nomenclature right. So I'm just looking at my notes here. You want to make sure that you're looking for on the ingredient, on the actual bottle label for the sanitizer, look for the word denatured. It basically suggests that there's some degree of bitter ingredients present in the actual sanitizer itself. So things like sucrose or butanol, additions to the actual hand sanitizer there, if a child were to make their way into the actual bottle itself, they're not going to want to take a large swig because it's bitter and not tasting well. So those are the key pieces here. Look for denatured, that term on the actual front-facing label of anything that you were to buy. Go for a spray because it's harder to actually open up the top potentially. Keep them out of reach of your children, and so in backpacks, purses, and then ideally make sure that they're small volume, out of reach. Those are really the keys, the key pieces here for mitigation.
And Michael, if I could just add on to what Dr. Gupta said, I think it's also really important if you look at the CDC's website, it says number one is to wash your hands with soap. And then number two would be to use a sanitizer. But the CDC first recommends just washing your hand with regular soap. And so I think that's really important as we're washing our hands frequently. When you're at home, when you have access to soap and water, that's the best thing to do. There should be no reason to be using hand sanitizers all the time unless you don't have access to soap and water. And when you're using a hand soap, you should look for something that's hypoallergenic, something that is utilizing plant-powered ingredients. You know, when you look at this virus, and obviously I'm on the call with both of you, you could speak to it better, but as I understand it, it's surrounded, right, by an envelope. And so the soap itself disrupts that envelope. And once you disrupt that envelope, you deactivate the virus and you wash it away. And so I really would encourage people, rather than using hand sanitizers all day long, please use just soap and water, and use hand sanitizers when you can't access it.
Absolutely.
So we have just a couple minutes left. So my last question is for you, Tyrone, and it's, is there a conversation going on that you're aware of about long-term impacts on children's health that researchers are having because of the increased use of cleaners and potential exposures to EDCs in this emergency right now?
There are. I'm less familiar with, because my focus is mostly agrochemicals. I'm less familiar with, but I know that there are studies going on in both public health as well as, so primary experimental-based research.
Okay, so then what the last thing I want to do is I want to thank you all for attending, the three of you, and I want to thank the hundreds of you who we can't see for participating in our first ever virtual town hall. This was, we have an annual gala which is large and a large amount of work, and this is a pretty big shift. And so now we're going to be doing many of these. The next one's going to be around the elections. And what we're going to be looking at is how to dive deeply into the relationship between the upcoming elections and the increased importance around environmental health and environmental justice. Wow. And the interplay between the two. So we'll be emailing out to folks details on that call. Right now we're working, we've got some folks who were pitching for them to participate that you know and have heard of. I hope you enjoyed today. I know I did. If you did, one option for you is if you felt like you learned something, I learned a whole bunch of new things, and I even do this for a living. And so you could go to ceh.org/donate, or I have to move my screen so I can see this because I don't know this by heart. Or you could text GIVE, G-I-V-E, to 510-288-3065, 510-288-3065. So I want to personally thank the three of you, three people who I admire so deeply. And I appreciate everyone who's coming, and I hope everyone has a great day.
Thank you. Thank you so much.
Bye.